This is a public service announcement from Ellsworth County Medical Center with facts everyone should know about the new coronavirus or COVID-19 outbreak. The 2019 novel coronavirus or COVID-19 is a virus, more specifically a coronavirus thought to be similar to other known coronaviruses such as MERS and SARS. It was initially identified in an outbreak of respiratory illness in Wuhan, China in 2019. Much is still unknown about how this new coronavirus spreads. Current knowledge is largely based on what is known about similar coronaviruses. Person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, similar to how flu and cold spread. These droplets can land in the mouths or on noses of people who are nearby or possibly inhaled into their lungs. There's also a risk of spreading by others touching objects or surfaces contaminated with the virus and then touching their own mouth, nose, or eyes. Typically, with most respiratory viruses, people are thought to be most contagious when they look the sickest. However, with COVID-19, there have been reports of spread from an infected person with no symptoms to a close contact. But remember, how a virus spreads from person to person can vary a great deal. Some viruses are highly contagious, like measles, while other viruses are less so. Unfortunately, there is much more to be learned about the transmission, severity, and other features associated with this coronavirus. Symptoms of COVID-19 can include fever, cough, and shortness of breath. Reported illnesses have ranged from people with little to no symptoms to people being severely ill and dying. The Centers for Disease Control, or CDC, believe that symptoms of COVID-19 may appear in as few as 2 days or as long as 14 days after exposure. The latest situation summary updates are always available on CDC's webpage under 2019 Novel Coronavirus. Who's at risk? As with most illnesses, older adults and people with chronic medical conditions such as asthma or diabetes may be at increased risk, but keep in mind these important facts. Currently, most cases diagnosed in the United States were travelers from China, quarantined repatriates, and those who were in close contact with diagnosed patients. At this time, there are very few cases of unknown origin. Because of this, your risk for exposure remains low, but the CDC reports your risk potential as high. For current up-to-date information, please note that the CDC website is listed below. The CDC reports new coronavirus updates daily. Ellsworth County Medical Center wants the public to know that it is part of a highly organized prevention and response effort toward any possible outbreak in our area. ECMC is in lockstep with the Kansas Department of Health and the CDC in managing protocols for prevention and, if necessary, mitigation of cases of the new coronavirus. We're working diligently with resources at the local, state, and federal levels to make sure our response plan is current. Our partners are well informed, and the local healthcare community knows exactly how to handle any eventuality. Points to remember. The 2019 novel coronavirus, or COVID-19, is a new type of coronavirus thought to be similar to SARS or MERS. Contamination is understood as caused by contact with either airborne particles from a cough or sneeze within approximately 6 feet, or contact with an infected surface, followed by touching the unaffected person's mouth, nose, or eyes. As with all viruses, frequent hand washing and surface cleaning is recommended. Currently, the spread is primarily involving travelers from China and close contacts to known coronavirus patients. The public health threat is considered serious, but individual risk is dependent on exposure, so for the general American public, the immediate health risk is considered low. Because of the risk potential, ECMC, along with several local, state, and federal resources, has prepared a highly organized prevention and response effort in the event of any local outbreak of this new coronavirus. Keep in mind, flu is currently a greater threat to public health. The CDC estimates that nearly 31 million Americans caught the flu last season, with almost 370,000 flu sufferers hospitalized because of the virus. In the 2018 season, there were almost 61,000 deaths linked to the flu. ECMC urges everyone to get a flu shot. It's not too late, and at the very least, the vaccine could possibly lessen symptoms and reduce their duration. For more information on flu and coronavirus, please contact us or visit www.cdc.gov.